Every day, your kidneys are working quietly behind the scenes. They filter your blood, balance your fluids, and remove toxins that would otherwise build up inside you. Most of us don't think about them until something goes wrong, but these two small organs are responsible for keeping your entire body in rhythm. When they start to slow down, the signs are often subtle, easy to miss, and sometimes even brushed aside as just another part of getting older. But paying attention early can make all the difference. I've seen it many times over the years. Someone feels fine for months, maybe a little tired, maybe a bit swollen around the ankles, and then suddenly their test results show advanced kidney disease. It doesn't happen overnight. It happens quietly. That's why awareness matters. When you understand what to look for, you can protect yourself and catch problems before they grow serious. Think of this not as medical advice, but as guidance, a conversation that might help you ask the right questions at your next checkup. And as you listen, let each sign become a gentle reminder to check in with your body rather than a reason to worry. One of the earliest signs that your kidneys may be struggling is swelling in the legs, a condition doctors call edema. You might notice your socks leaving deeper marks on your skin or your ankles looking puffier than usual at the end of the day. If you press your finger into the swollen area, it may leave a small dent, like pressing into a soft marshmallow. What's happening inside is that your body is holding on to extra salt and water instead of releasing it. The kidneys are supposed to manage that balance, but when they can't, the fluid often collects in the lower part of the body. This is your body's way of saying the filters are under strain and could use support. Of course, swelling can come from other causes too. Sometimes the heart is the issue, especially if it's not pumping strongly enough. In other cases, a blood clot or a liver condition might be the reason. That's why it's important not to assume. But what many people don't realize is that kidney disease can also be a hidden cause of swelling. When the kidneys lose the ability to filter protein correctly, some of that protein leaks into the urine. The body then reacts by holding onto fluid, leading to swollen legs and feet. Paying attention to this pattern, swelling that lingers, socks that leave deeper lines, can help you and your doctor look in the right direction sooner. If you've noticed this kind of swelling, even if it seems minor, it's worth asking your doctor to check your kidney function. A simple blood test and urine test can show whether your kidneys are working as they should. This small step can catch disease early, often long before you feel sick. Many patients who later discover kidney problems tell me they wish they'd asked for those tests sooner. It's a reminder that being proactive isn't about fear, it's about self-care. Think of these tests as routine maintenance for two organs that work for you all day, every day. There are other small clues that swelling might be related to your kidneys. Some people notice their urine looks darker, like tea or cola, or that their blood pressure is slowly climbing for no clear reason. When these symptoms appear together, it's a gentle alarm from your body. Your kidneys are part of a delicate system that depends on good circulation and steady pressure. When they're under strain, the effects ripple outward, into your heart, your energy, even your mood. Linking these clues, color changes, pressure shifts, swelling, can point to a single story. The kidneys need attention. Many times, swelling in the legs is the first visible sign, but it's only the beginning of the story. The next one is more deceptive and often misunderstood: recurring urinary problems that seem like infections but aren't. Imagine this. You go to the doctor with burning or discomfort when you urinate. They run a quick test, see a few abnormal cells, and assume it's a urinary tract infection. You take antibiotics, feel better for a while, and then the symptoms return. This cycle can repeat again and again, even though the lab reports never show bacteria. When symptoms repeat without a clear cause, it's a cue to look deeper at the kidneys themselves. When that happens, it's time to pause and ask a deeper question. Could something else be going on? Sometimes what looks like an infection is actually inflammation or damage inside the kidneys themselves. Blood or protein in the urine can appear for reasons that have nothing to do with bacteria. They might be early signs of kidney disease, the filters inside the kidneys becoming irritated or scarred. Antibiotics can't fix that because it's not an infection problem. It's a filtration problem. Recognizing this difference helps you move from short-term relief to real answers. If this sounds familiar, if you've been treated for urinary infections over and over without clear evidence of bacteria, don't ignore it. Ask your doctor for a full kidney evaluation. That means checking the blood for waste levels like creatinine and testing the urine for protein or microscopic blood cells. These small steps can reveal issues that would otherwise stay hidden for months or even years. Clear information leads to clear action, and clear action protects your kidneys. Your kidneys don't send strong warning signals when they're in trouble. They whisper. They show you through changes in your urine, your energy, your blood pressure, and your swelling. Listening to those whispers early gives you the chance to act before the damage becomes permanent. It's not about panic, it's about paying attention. And when you pay attention, you give your body the time it needs to heal. There's one sign that surprises many people because it's so easy to overlook. You finish using the bathroom, glance down, and notice the water filled with bubbles. At first, it seems harmless. Maybe you think it's just the force of the stream hitting the bowl, or maybe it's something you ate. But when those bubbles appear often, when they're thick, foamy, and take longer than usual to fade, it could mean something more serious: protein escaping from your blood through your kidneys. This is your at-home clue that the filter might be leaking what it should hold in. Inside your kidneys are millions of tiny filters called nephrons. They're designed to keep essential nutrients like protein in your bloodstream while letting waste pass out into your urine. When these filters become damaged or inflamed, they can start to leak. The result is protein loss, and one of the easiest ways to notice it at home is through unusually bubbly or foamy urine. Think of it like a coffee filter with a small tear. What should stay in begins to seep out. When the bubbles linger and other signs are present, it's worth a closer look. Not everyone with bubbly urine has kidney disease. Sometimes the bubbles are just from speed or air pressure. But if you're noticing other symptoms too, swelling in your legs, darker urine, fatigue, or rising blood pressure, that's when you need to pay closer attention. These signs together can indicate that your kidneys are under strain. It's not about guessing or worrying, it's about getting the right tests. A urine protein test and a blood test for creatinine can tell you in a matter of days how your kidneys are really doing. Quick checks, clear answers, better choices. Protein in the urine isn't just a number on a lab sheet. It's a warning that your kidneys are losing ground. The earlier you find it, the better your chance to protect what's left. The body has an amazing ability to heal when given the chance. With the right diet, exercise, and medical care, you can often slow or even stop kidney damage before it advances. I've seen patients who caught it early and went on to live decades with healthy function. Awareness makes that possible. Early action gives you options. Delayed action takes them away. When kidneys struggle, your whole body feels the effects. Waste that should have been filtered out begins to build up in your blood. You might feel tired for no reason. Your appetite might fade, or you might notice a metallic taste in your mouth. Some people experience itchy skin or mild nausea. These aren't random symptoms. They're the body's way of saying it's working harder to clean itself. Listening to those quiet messages can save years of trouble later. If you hear the message, take the step. Another clue comes from your blood pressure. The kidneys don't just respond to pressure, they help control it. When they're damaged, they can release signals that tighten your blood vessels, raising your pressure even more. It becomes a loop. High pressure hurts the kidneys, and damaged kidneys raise the pressure further. Breaking that cycle starts with awareness. If your blood pressure is creeping up despite eating well and staying active, ask your doctor to look at your kidney numbers too. They're often connected. Seeing the link helps you treat the cause, not just the number. One of the most encouraging truths about kidney health is that small changes really do matter. Drinking enough water to stay hydrated, limiting salty foods, balancing your blood sugar, and avoiding unnecessary painkillers like ibuprofen. These habits protect your kidneys every single day. It's not about perfection, it's about consistency. Each healthy choice gives your kidneys a little more room to breathe. Simple steps, repeated often, become protection. If your doctor finds that your kidneys are under stress, don't lose hope. Most of the time, early damage can be managed or even improved. Medicines can help lower blood pressure, reduce protein loss, and protect those tiny filters from further harm. But medicine works best when you also take control of your habits. Gentle movement, a balanced diet, and avoiding dehydration can make a major difference. Your daily routine becomes part of your treatment. People often ask if kidney problems are always permanent. The answer depends on how soon you act. Many forms of damage are reversible when discovered early, before scarring sets in. That's why these early signs, swelling, bubbly urine, high blood pressure, unexplained fatigue, should never be ignored. They're not meant to scare you. They're signals of opportunity, a chance to step in before it's too late. When you respond to early signals, you give yourself the best chance for long-term health. When you understand how your kidneys work, you begin to see how connected they are to every part of your life. They're not just filters. They're regulators, guardians, and silent partners in everything your body does. Each heartbeat sends blood through them, and every drop that passes through is cleaned and balanced before returning to nourish your organs. It's a remarkable system, but like any system, it depends on care. If the pressure is too high, if the salt is too much, if the strain lasts too long, those tiny filters start to weaken. And once they weaken, your body feels it in ways you may not expect. That's why steady, thoughtful choices are worth it. Fatigue becomes normal. Appetite fades. Your sleep changes. Some people describe it as feeling older than they are, or as though the energy that used to come easily has been replaced by a slow, heavy rhythm. These are gentle warnings, not punishments. They're reminders that the body is asking for relief. The best part is that relief is possible. You don't have to rebuild everything overnight. You only need to start with awareness, curiosity, and consistency. One clear step leads to the next. Begin by watching what goes into your body. Too much processed food, too many salty snacks, and too little water make the kidney's job harder. Choose meals rich in vegetables, fruits, and whole grains. Keep protein balanced, not excessive. Simple habits like staying hydrated, avoiding sugary drinks, and limiting alcohol reduce the toxins your kidneys need to handle. If you smoke, consider quitting. The blood vessels that feed the kidneys are as sensitive as those in your heart. Protect them. Your plate and your cup become tools for healing. Movement also helps. You don't need to run marathons. Even a daily walk improves circulation and keeps blood pressure in check. Gentle exercise helps regulate sugar and reduces the inflammation that silently harms kidney tissue. Think of each walk, each glass of water, each moment of rest as a quiet thank you to your kidneys for what they've done every day without asking for recognition. Small routines turn into big results. Stress plays its part too. High stress releases hormones that raise blood pressure and interfere with healing. Finding ways to relax through breathing, music, prayer, or simple silence gives your body the space to repair itself. The kidneys heal best when the body feels safe. Calm isn't a luxury, it's medicine. Give yourself a little calm each day and let your organs benefit from that peace. If your doctor suggests monitoring your kidney function, don't ignore it. Follow up on those tests. Track your numbers and ask questions until you understand them. Creatinine, GFR, protein in urine, these aren't just lab values. They're the language your kidneys use to tell you how they're doing. Learn that language. The more you understand it, the better decisions you'll make about your health. Knowledge becomes confidence. Confidence becomes action. And if you ever feel uncertain, reach out for professional help. Seeing a specialist doesn't mean something terrible is happening. It means you care enough to get the full picture. Many people who take that step early discover their kidneys can stabilize and even improve. It's not luck. It's awareness combined with action. You deserve a clear plan and steady support. There's also hope in community. Sharing your story helps others notice their own warning signs. A conversation with a friend or family member can lead them to check their health before problems grow. You never know whose life you might change by simply talking about what you've learned. Knowledge multiplies when it's shared, and shared knowledge saves health. As you think about your kidneys tonight, imagine the constant flow happening inside you. Blood being cleaned, waste removed, balance restored. It's a rhythm that never stops, even when you sleep. Supporting that rhythm doesn't require anything extreme. It just needs attention. The same way you'd water a plant before it wilts, you can nourish your kidneys before they fail. A little care today becomes protection for tomorrow. If there's one message to take away, it's this. Don't wait for pain to listen to your body. Pain comes late. The whispers come early. Swelling, foamy urine, fatigue, pressure. Those are not burdens, they're invitations. Responding to them is how you protect your health, your independence, your future. Each small choice is a vote for your well-being. Every small act counts. Choosing water over soda, walking instead of sitting, taking time to rest. Asking your doctor one more question. These are how you prevent big problems later. Your kidneys don't demand attention, but they always deserve it. Keep them in mind, and they'll keep you moving forward. Every day your kidneys are working quietly behind the scenes. They filter your blood, balance your fluids, and remove toxins that would otherwise build up inside you. Most of us don't think about them until something goes wrong. But these two small organs are responsible for keeping your entire body in rhythm. When they start to slow down, the signs are often subtle, easy to miss, and sometimes even brushed aside as just another part of getting older. But paying attention early can make all the difference. I've seen it many times over the years. Someone feels fine for months, maybe a little tired, maybe a bit swollen around the ankles, and then suddenly their test results show advanced kidney disease. It doesn't happen overnight. It happens quietly. That's why awareness matters. When you understand what to look for, you can protect yourself and catch problems before they grow serious. Think of this not as medical advice, but as guidance, a conversation that might help you ask the right questions at your next checkup. Your kidneys have been faithful for decades. Give them the care they've earned. Listen when they whisper. Help them before they ask twice. And remember, health isn't just about adding years to your life. It's about adding life to your years, feeling light, energetic, and free to do what you love. That's the reward of caring for the quiet parts of yourself that never stop caring for you. If this message helped you, share it with someone who might need it. Like this video, subscribe for more simple, science-based health guidance, and ask your doctor about a blood and urine test at your next visit. Start today with one small step. Drink water, take a walk, and give your kidneys the attention they deserve.